on mental health, and the world marks Mental Health Day today. The growing prevalence of mental health challenges among students in higher education has become one of the most urgent social and institutional issues of our time. Across South Africa, university students are navigating complex academic, emotional, and financial pressures that can severely impact their well-being, and universities have a duty to be responsive to and address this matter with the urgency it deserves. For more on this issue, we're joined by Dr. Alucia Mabunda, who is head of the Neslson Mandela Bay Campus at the IIE Rosebank College. Dr. Mabunda, thank you for joining us. How are you this morning?
I'm good in yourself. It's Mabunda.
Mabunda. All right, thanks for that
Yes.
correction. Dr. Mabunda, how critical is mental health support for university students? This is a critical time in one's life.
Look, it is critical, especially if one is to look at it as to what is at stake, because as institutions, we are looking forward to having all our students that are enrolled firstly completing their qualifications in record time. And as a nation overall, we are expecting that those graduates should be able to be in a good mental state that will also allow them to step into the labor market, and obviously with the broader aim of leading economic growth. So if we have cases that make it impossible for students to complete their studies with us as a result of mental health cases, it has a dire effect not only on the institution, but on the entire nation at large.
Would you say that as it stands, the mental health prevention interventions implemented at different institutions of higher education learning are adequate to support the students there?
Look, definitely the support that is provided is enough. I mean, we have Higher Health, which works with all the institutions of higher learning. And for institutions like Rosebank College, we also have on site wellness managers, which comprises of qualified social workers that are there to attend to the mental needs of students. However, our greatest challenge is accessing those resources. And when I say accessing, it's not that they're not there, but the people who must access them are either derailed, or they find it difficult to utilize those services based on judgments and how mental health is viewed by others. So we need to improve access in the sense that our students should be free to actually request such services and not feel like they are some way not okay, or they should be deemed in another manner by fellow students should they determine or find out that they're sourcing such kind of services. We do have adequate support available for our students.
A national study conducted across 17 South African universities found that 37.1% of students met the criteria for anxiety disorders, 16.3% for mood disorders, and 24.4% reported suicidal ideation with the preceding month. Despite this, only about 1 in 5 received treatment. So these are quite alarming figures. And what mechanisms then are needed, Doctor, to put in place to address this particular challenge?
So it's important for universities to integrate mental health into institutional strategy. And it also extends to the allocation of resources such as counseling and support, which are some of the things that I touched on. And more so, it's to train the academics, because these are the people that are in the classroom with the students most of the time. So they must be capacitated to have the skills needed to identify students that may be at risk. And this does not only stretch to lecturers, but even administrative staff that deal with students from time to time. Someone at the front office, perhaps the administrator, may be able to spot a student to say, I have seen the student coming into the institution numerous times, and this is usually the character that they present when they walk in here. However, in the past couple of days, I have been able to notice that there's been a change in terms of behavior or how they conduct themselves. So these things are important. Everyone within the institution must be capacitated and trained so that they know how to identify these kinds of students that need help. Another measure is regular well-being check-ins, and institutions can also then just conduct anonymous mental health surveys to find out what is on the ground, what are the issues that we're dealing with, and constantly have and conduct workshops on stress management, because one of the greatest things that lead to mental health issues is the inability to handle stress, not knowing what to do when things go the other way. Emotional regulation, and just resilience. And so it is important that we are proactive and close off all these gaps, create awareness, train the people, and also get the students to be aware of the services that are being provided.
And I can imagine in handling that stress that a student might be conflicted between, I'm no longer a child, I'm an adult, but I'm not really fully an adult yet, and I need to be able to handle things on my own, or do I handle things on my own? That stage can be quite challenging in that aspect as well. You are of the view that mental health crisis in higher education is both a moral and strategic imperative. Can you elaborate?
So it has to, I think I'll just go back briefly to when I spoke about the overall impact that it has on everyone, be it the institution, be it the country, and we owe it to our students as educators or people in institutions of higher learning, in the sense that all educators have a role which is called the pastoral role or the community engagement role. So
Mm-hmm.
it is important to teach or train learners that we know that they are in a good mental state. And therefore, if you are going to engage learners in activities while you can see that at this particular point in time, they are not coping, and you have deadlines that they have to meet without making provision or ensuring that there's flexibility, you sort of like cross the moral boundaries whereby we are sort of like removing humanity and just focusing on the end goal. But the truth is, we will never reach the end goal if we do not make a provision to deal and address with the issues that eventually have an impact on the outcome of what we are teaching as institutions.
Dr. Mabunda, we thank you so much again for your time this morning.
Thank you so much. Have a blessed one, and I wish everyone good health during this key month.
Thank you so much. Dr. Alucia Mabunda, head of the Neslson Mandela Bay Campus at the IIE Rosebank College, talking to us about the importance of mental health awareness amongst students in higher learning institutions.
Tune in and turn up the volume.